care issues, this was an opportunity, and it's too bad, the member from Brant didn't mention this, but like this was an opportunity, and you would have had our full support if you had negotiated a deal for eye care in Ontario, and that should have been here. We believe that eye care is health care. In fact, we know we have all anecdotal circumstances across in our ridings, but I will tell you that my son's good friend, his optometrist caught his brain tumor. Think of the opportunities that we are missing on this front. And the optometrists have been fairly clear, as has the member, Ms. Marteau, last week. She came out and she said, listen, she issued a statement last week calling on her party, that would be you, to abandon the hard line it has taken with the Ontario Association of Optometrists. She says she's an optometrist herself, as the member from Brantford Brant is as well, and she argued her professional colleagues are in the right. This is, she broke ranks, although there's been a lot of people that have sort of been exited out of the party, but this is an intentional breaking of the ranks and an exposing, the hardline tactics that this government has been making with optometrists. And she goes on she says their colleagues are on the right, and she poked holes in the province's justification for not yielding to the association's demand that it commit to covering the cost of OHIP eye services as a precondition to resuming negotiations. She called the government's current offer unsustainable and criticized the province for the heavy-handed tactics. So there's a whole new discourse on this tension and drawn out, tension between optometrists and the Minister of Health. And we all know, I've been getting 2, 3, sometimes 5 calls a week from parents who are concerned about their children who cannot access eye care and cannot see the board or the whiteboard in their classroom. At least we can acknowledge, we can find some common ground that this is an issue. It's an issue for seniors who can't drive. They can't get their licenses renewed. They want their independence. Seniors, just in case you don't know this, they vote. And they are mad. In fact, I have never seen so many activist seniors in Ontario. These are very different, of course, from the downtown activists who are fighting Highway 413, who actually apparently live in the Minister of Transportation's riding, and they're very upset that they've been called downtown activists. And millionaires, yes. Yeah. You can't forget the millionaires in the Minister of Transportation's riding. So this long drawn-out thing with optometrists is really, what is the game plan here? We want to know. The people of Ontario want to know. Like, how are you going to extricate yourself from this now 239 days, Madam Speaker? And this is from the Ontario Optometrist Association of Optometrists site, and they're just putting this out there. We would like to provide you with an update on our discussions with the Ontario government. Unfortunately, since September 1st, millions of Ontarians have lost access to primary eye care services because the Ontario government continues to neglect optometry services. And here is the update. The number of days optometrists did not hear from the Ministry of Health. The Ministry of Health did not communicate with optometrists from December 5th of 2020 to August 5th of 2021. An independent third-party accounting firm, BDO, determined that the average operating cost for rent and staff and equipment to provide an eye exam in Ontario in 2019 without doctor compensation was $75.51. What does the government come back with? $48.43. So, the Minister of Health, interesting, because these things come back, right? They come back to bite you. With the pharmacists back in 2010, she said, why should the pharmacists have to pay to do the work that should be funded by the government? And, I send the same question back to the Minister of Health on this. Why should optometrists be heavily subsidizing the OHIP-funded patients, seniors, and childcare? Unless you've made a political decision that you no longer want to value eye care at all and don't see that it is a prevention piece on the healthcare file. So that level of frustration is off the charts. For some of us who were here when the Liberals were here, they always used to describe themselves as overachievers. Well, on this file, you are overachieving on an incompetence level that we haven't seen for quite some time. I mean, get back to the table. Seniors, children, vulnerable Ontarians, they need their eye exams. We need them to get access to that care. And also remember, I mean, a lot of optometrists during the pandemic never received any support from this government. I mean, I don't know what the game plan is. Maybe you don't either, but it's going to become a huge political football. And I know that you care about your political fortunes because this document proves that. It proves that you are more concerned about your political fortunes than the very people that we serve. And so on healthcare, I'm including the repealing of Bill 124. Why it has taken so long, I have no idea, nor do the nurses. The optometrists are completely frustrated. You must be inundated. One of your own has broken ranks and revealed that there's really no strategy here, except that you want to play hardball. And I hope that the optometrists that sit on that side of the House can actually try to sway this Minister of Health to get eye care back in the healthcare realm. I mean, it's well overdue. On the issue of vaccines, I mean, I brought forward a motion to the floor of this legislature